Ko mātou te haukāinga o te takiwa whānui nei o tāma. Ngā parati I rungi te wai o te Manukau. Mahi tahi ana ki te puhinui rere haere nei. Mātou kai roto I tēnei te pūtahitanga. Ana tetahi o tō ngā kaupapa I aia, te wā hangaia te nei wai. O te puhinui te te o ngā tino kaupapa. Ora ana te wai, ora ana te whenua, ora ana te tanga. Nō reira atu I tira tāpū, hare mai, hare mai, hare mai. Taira rohi o mai, ngā te arapu e, rumau ngā puketa, puti rohi atu ko, e hirunga I tomoa, na manu, ka te manu, ka hoturo, wa ngā tai arakatau, ura te motu ahiaro, wa kei konei kei wha, re kei konei tara mainu, ku ngā tani whatupu, nā roto tāma ki makau, lau tāma ki he he, e o ngā wā, ka o te iwi e. E kapi ngā kōrero mātu e maumaratia, tonu tiana rātou ko te tūrangitia. O tau atu ana ki te puahawa te Manukau I reira ko kapohia nei te kupenga taramaitu, I reira ka kawe atu ki ngā rangi tūhanga. Reira rātou tatari mai. I te ao, I te pō. Atu I tērā, kāre ware tiana, te āhuatanga, tō tātou kuini Māori, ki ariki nui, kuini ngā waihono I te pō, o tira tōna nei whānau. Kia koe e te minita, koutou, o te pāti nāhi nera, hoki ngā mahara ki te wahehia na taku teina, kia tū I rungi te tehi o ngā tūru a nāhina, aua ki aua. Koe no, tai ki te wā, koi tēnā I tēnei rangi. Inboa.
Tēnā koutou katoa, te whare uti nei, tēnā koe. Tēnā rawa atu kōrua I tō mihi. I ngā iwi, hapu, marae maha, o tēnei rohe, kei te mihi, kei te mihi, kei te mihi. Te merita, tēnā koe. Te rangatira, Graham, tēnā koe. Kia koutou no ngā hauewha, tēnā koutou, tēnā koutou, tēnā koutou katoa. It's a real honour and a privilege to join you here today and to have so many guests with special connection to social investment and particularly to our work of making a difference in the lives of New Zealanders. Thank you for your effort to be here and really excited to reach this milestone. It's my privilege to introduce our Minister, Minister of Social Investment and of Finance, Nicola Willis. Thank you very much for being here today with us and we're looking forward to hearing from you. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa.
Kia ora koutou katoa. Nau mai, haere mai, piki mai. Ki te mihi atu ahau, ki na mana whenua nei, tēnei te mihi, kai karakia, ko Riki Mihinik. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you to the Southern Initiative for hosting us in Manukau today. As many of you will know, the Southern Initiative champions social and community innovation in South Auckland to drive real change for people in need. There are many parallels with the work the Social Investment Agency is doing, and I'm delighted to be making today's announcement here. I would also like to acknowledge the presence of Social Investment Board members, Dr. Graham Scott, Mike Williams, and David Woods, along with Andy Costa and the leaders from the Social Investment Agency. Last year, at a hui in Wellington, I told a story about Jack. Some of you were there to hear that story about Jack. It was not your classic Hollywood underdog story, maybe something closer to home, gritty and independent, and without a cosy fairy tale ending. When we left Jack, he was 22 years old, had been arrested for assault, and was heading to prison. His pregnant partner Danny and 4-year-old son were living in a damp, overcrowded rental in South Auckland. He had had frequent and extensive interactions with government services, which had not been successful in providing the intervention or support he needed to break the cycle. Over successive decades and successive governments, it's become increasingly clear that despite billions of dollars being spent, major barriers in the system are holding back change for people like Jack. And the sad reality is that despite many good intentions and some extraordinary work by individuals and communities, outcomes haven't improved for too many of our most vulnerable New Zealanders. People like Jack and his partner Danny, whose complex needs span multiple government portfolios. Since we last talked about Jack, the Social Investment Agency has been developing a new social investment approach for better delivery of social services. The government, as you know, currently funds a huge number of non-government organisations to deliver social services to improve the lives of vulnerable New Zealanders. But many of these providers are operating with one arm tied behind their backs because of a traditionally fragmented, short-term approach to contracting. I've been told of providers juggling over 100 different government contracts with up to 17 different agencies, many of them renewed every year. That creates uncertainty, it pushes up costs, and it drives short-term thinking. Contracts are often highly prescriptive, focused on easily measured outputs and inputs, rather than the outcomes that actually matter to people's lives. Social providers I speak with report spending up to a third of their time on government auditing and reporting, rather than using that time to work with the people they are supposed to be helping. And those delivering services that span multiple government agencies often find that their overall impact goes unrecognised. Each government agency sees only the part that relates to its silo, missing the broader value of the work. And as a result, effective integrated community support is undervalued, and the people who need it most, like Jack and Danny, miss out. And I know that the people in this room know that New Zealanders like Jack and Danny require intensive and bespoke services, which are most effective when provided in their communities, not one-size-fits-all programs driven by the organisational needs of Wellington bureaucracies. Social investment flips the model. It puts people, like Jack and his whānau, at the centre of social service delivery. It means being clear about the outcomes we, the government, are purchasing, who we're targeting, and the data and evidence we will use to determine what is and isn't working, and what we should and shouldn't be funding. And it means partnering better with the organisations like many of you here today represent, who are best placed to help the likes of Jack, Danny, and Jack Jr. thrive, as long as government will let you. So to drive this change, today I am announcing that Budget 2025 allocates $275 million over the next 4 years for Vote Social Investment. The centrepiece of the social investment budget is a new $190 million social investment fund, a fund designed to change lives and tackle the very problems we've talked about: short-term contracts, siloed funding, and a lack of focus on outcomes. In addition, the Social Investment Agency has been allocated $20 million for initiatives to strengthen parenting in the first 2,000 days of a child's life, reducing harm and setting children up for better lives. And $25 million for initiatives to help prevent children and vulnerable adults from entering state care, a key part of the government's response to the Royal Commission of Inquiry into historical abuse in state care. The focus of today's announcement is the Social Investment Fund. I want to tell you a bit more about it. It will invest in services that deliver measurable improvements in the lives of those who need our help, guided by data and evidence. It will support both new approaches and strengthen existing services that have been proven to work. And each investment will have robust evaluation built in from the start, so government can track the fund's impact and invest taxpayer money with confidence. The fund is expected to invest in at least 20 initiatives over the next year. And so today I'm pleased to announce the first 3 initiatives which demonstrate how the fund will work in practice. The first is an Autism New Zealand initiative to each year help 50 families of young children who are autistic or showing signs of autism by intervening early, so that families, teachers and other professionals are better able to help these young people thrive at school. We know that early intervention works, and this program is a chance to do it. The second initiative extends to another 80 families an evidence-based, proven Emerge Aotearoa program that has been proven to reduce youth offending and truancy. The third is He Piringa Whare, a program delivered by Te Tihi o Ruahine, an alliance of 9 hapu iwi Māori organisations and providers with a track record of using data and evidence to shape its services. The He Piringa Whare program will support over 130 families at a time to live in warm, dry homes, engage them in education, training and employment, and support whānau to live in relationships that are free from violence. So all 3 of these initiatives have established expertise, but all have historically struggled to secure funding for their services because the outcomes they deliver span multiple government agencies. My goal is that the government's new approach will help us prove the return on these investments so we can scale them up over time. But what might the work of the Social Investment Fund actually mean for someone like Jack and Danny? It could mean a coordinated response from Te Tihi, support for Jack as he reintegrates into his community after prison, parenting programs for him and Danny, smoking interventions when Danny is pregnant, tailored housing support and education and health services wrapped around their young family. Not a patchwork of agencies working in silos and providers cobbling together piecemeal funding and contracts. It means a dedicated support worker who knows their whānau and a stable home for Jack, Danny and their children. It means early identification of autism for Jack Jr. when his Plunkett nurse sees signs of autism and refers him to Autism New Zealand. Autism New Zealand, in turn, could provide Jack's whānau with tools to better understand his needs and get him ready for school to set him up for success. Provide access to the learning support his father would likely have benefited from and did not get. And ongoing support for the whole family, setting the foundation for long-term success. We're not talking about waving a magic wand, applying a quick fix, or simply servicing misery. This is about investing in smart, targeted early interventions that not only make a difference in the lives of Jack and his whānau, but that mean the government reduces the money it might otherwise have spent on treating the symptoms rather than the causes of dysfunction, be it at the crisis end of the justice system or the health system, or government-provided income support. Maybe, if Jack had received something like Emerge's services as a young person, things wouldn't have progressed to where he was heading to prison. Emerge's multi-systemic therapy program, which we are funding today, has seen at least 80% of the young people it works with engaged in education or work with no new arrests. The Social Investment Fund is starting small, but I see potential for it to achieve significant scale over time, because government agencies currently spend about $7 billion each year buying social services designed to improve lives from non-government agencies. And in the years ahead, we want to see more of this funding and more of these contracts transferred into the Social Investment Fund. We will work with providers and communities who want to consolidate their multiple government contracts into one genuinely outcomes-based contract. The government is also open to an idea I've talked to many of you about, which is the pooling of social sector funding from multiple government budgets into a single fund under local decision-making. We often hear local leaders saying that they could do a better job of investing in outcomes than multiple government agencies. We want to hear from you about how we can make this work. We're also creating the opportunity for future co-investment opportunities with the philanthropic and private sector. The Social Investment Fund is a rejection of the failed approaches of the past. It's being set up as a totally new way of working with you. And you are the people who know Jack and Danny best and who are best placed to impact their lives for the better. I see the fund as a force for enduring change that will survive changes of government. Because Jack doesn't care who's in the government. He doesn't care that the providers that have been in contact with him have been doing it hard. He doesn't know that they scrounge and scrape to get by, managing dozens of contracts with agencies, getting endlessly audited and reporting back on every minor detail. A central fund with a clear mandate gives us the best chance of working with those outside of government to improve the lives of the most vulnerable New Zealanders. The Social Investment Agency also has a wider leadership role. Its purpose is to demonstrate and accelerate change that ensures all government agencies invest more effectively to deliver better outcomes for New Zealanders. It is building tools, infrastructure and methods that both government agencies and the wider social sector can use. That includes better ways to track progress, measure outcomes, use data and understand what's actually working. This will improve the way the government delivers mainstream social services in health, education and other areas. For example, the government, as you know, invests billions of dollars in education every year, but the returns in terms of literacy, school attendance and long-term outcomes are not where they should be. We know that many kids with additional needs struggle throughout their time at school. And we also know that if we intervened earlier to help them, they'd be capable of achieving a whole lot more. So this is a prime area for applying a social investment approach, targeting resources earlier, backing what works, and ensuring that spending leads to better outcomes later in life. Because if we get it right early, we reduce the need for far more expensive interventions down the track. So you can expect to see this thinking heroed in this year's education budget. And I'm looking forward to saying more about it next week. It's not just about education. We want every government agency to be asking, how can we invest smarter? How do we make sure our spending is improving lives, not just funding activity? And that means being open to innovation. And by that I mean being open to and enabling new approaches to existing challenges. We need to recognise that overly risk-averse approach traditionally taken by government agencies has not shifted the dial, especially for families with high and complex needs or intergenerational challenges. We also know that innovation is happening outside of the Wellington system, in spite of the barriers government can put up. So we want to back communities and non-government organisations who show insight in their use of data and evidence, who are willing to innovate and to clearly evaluate what's working and what's not working. It's about constant improvement. And we want to see data used to constantly measure the progress being made and to identify how we can do better together. Data, evidence and infrastructure form the backbone of the social investment approach. Together, they provide for safe and secure data sharing that enables the government to understand where it should focus its efforts. They also enable providers to understand their impact and what else you can do. A key goal, and I want to emphasise this, a key goal for the Social Investment Agency is to reduce the amount of reporting and data being sought by government agencies from providers. We recognise that the amount of meaningless information presently sought by agencies can be burdensome for non-government organisations and often adds very little value relative to the work required to provide it. So social investment contracts under our new approach will be designed to reduce the amount of data being required, but collecting the right data while improving our insights about what actually has impact. Social investment, of course, not only improves lives, it also frees up resources for investment in other priorities. When we invest even relatively small amounts in the right places, that can lead to bigger and better impacts, both socially and fiscally. And so our government is willing to make investments up front to drive durable savings down the line. We're starting to shift how this logic is reflected in the budget process. It helps that the Social Investment Minister gets along well with the Minister of Finance. And we recognise that not all spending is a cost. Some spending is investment that provides a social and financial return over the longer term. And when it's well targeted and backed by evidence, it can pay for itself many times over. And we've already put this theory into action. In December 2023, more than 3,100 households were living in emergency housing motels, often for months at a time, and at one point costing the country around $1 million a day. Some of these motels became long-term living arrangements for families with young children. It was one of the most visible policy failures in recent memory, unsustainable, expensive, and harmful to the people stuck in the system. So we changed approach. We made families with children a priority for social housing. We made an upfront investment of $80 million, and we worked across agencies to support people into stable housing, including private rentals. The result of that upfront investment and approach was that by December 2024, the number of households in emergency housing dropped to 591, a 75% reduction in just 12 months and 5 years ahead of the target we set coming into office. This is not just a huge social success for the thousands of families now raising their children in proper homes. It's also a huge success for the taxpayer, with savings of nearly $1.35 billion forecast over the next 4 years. And that is hundreds of millions of dollars that would have been spent on motel bills, instead able to be reinvested back into social services, education services, health services. Budget 2025 builds on this approach It includes further initiatives where smart, early investment is expected to generate real savings, including in areas like employment, where helping someone into work today not only changes that person's life prospects, but it also leads to savings for the taxpayer. So this is how our government will build a social system that's more effective, more sustainable, and that replaces heavy-handed bureaucracy with real results. So let's fast forward 10 years. On this trajectory, we expect to see Jack, Danny and their children thriving, living in a home full of hope, not hardship. Jack and Danny have been able to give their children stability that they themselves haven't had. And with parenting programs and community support, they have a confidence and a sense of their own agency over their own lives, a sense of belonging brought about by interventions that were targeted, responsive, holistic, and locally driven. We're looking forward to seeing communities drive this change that we want to see, and we know that real change will come from the leadership of people like those in this room, not policy advisors on the terrace. Today's budget announcement is a big step forward. It signals the government's willingness to do things quite radically differently. Over the next few years, I expect to see significant amounts of funding transferred to the Social Investment Fund, which will enable providers like yours to work holistically and flexibly to improve people's lives. Our government believes in the potential of every person growing up in this country, because every New Zealander deserves the chance to live in a home full of hope, not hardship. That is the vision for social investment, and I am looking forward to working with you to make it happen. Thank you.
Thank you very much, Minister. Very exciting times ahead of us, and I know there'll be lots of questions. So we do have an opportunity now for Q&A. Minister will be speaking with media after this session, so if I can just ask that we keep this session focused on social investment and open it to the room for what questions you might have.
Well, alternatively, I can go and talk to the media and then we can circulate afterwards.
Kia ora, Henry Clark from Genesis Youth Trust. We've been working in the social investment space, especially over the last 6 years, delivering all the outcomes that you're looking for as part of the social investment agency. My most pressing issue right now is sustainability as you work towards delivering some of the contracts that we just finished talking about. So is there something in there that says how are we going to sustain ourselves until those contracts, those initiatives that we're talking about come to fruition?
Yeah, well look, the work you do is a really good example of work that spans multiple government agencies because when you work with young people, that supports the police to do their job better, it supports the Ministry of Justice to have fewer people in the courts, it supports the education system to better engage young people, it supports the Ministry of Social Development to have fewer people on benefits. And so I am aware of the challenges that your organisation has had in piecing together contracts. It's exactly that sort of problem that I want the Social Investment Fund over the medium term to be solving. We have to prove this works. We will not be able to fix every contract all at once. And it's very important to me and the government that we demonstrate success with the contracts that we engage in. And so we will be asking providers to come to us if they are willing to try this new approach, if they see a case for consolidating their existing contracts, and if they are willing to work in this way that's really about driving outcome. So I'm conscious that the Social Investment Agency may have a red hot phone line calling. I hope so, because that tells me you're up for doing it differently and changing things. But I do want to be clear. We are starting modestly. This is something we need to prove and build over time.
Bill Kermode from the Centre for Strategic Philanthropy Minister. Congratulations on doing something tangible in that respect. I guess two questions. One, on the same theme of sustainability, those three organisations that you're talking about initially, are they multi-year commitments in terms of how you're thinking about those? And the second question is really around the fund. What can you tell us around how it will be governed and operated?
Yeah, so taking each of those questions, yes, we envisage multi-year contracts. We've heard the feedback, which is very clear, that actually having the opportunity to plan over the longer term allows you to do better work often. But what we also want to achieve is accountability for the investment we're making. So we envisage using the agreed outcomes that the provider and the agency agreed to, and the agreed approach to measuring those outcomes as check-in points along the way, so that we can check and adjust to see, are these contracts delivering what we thought they would? Is this organisation having the impact it hoped for? And then to check and adjust as we go. But doing that within the sustainability of a longer term contract, so that we can have that innovation actually happening, and the certainty allows that to happen. And the second question, to the way that the fund will be governed, the Social Investment Agency, through its executive, will be leading fund selection choices. I want to assure you they will be removed from me in terms of the specific providers. However, there is a group of social investment ministers who will set our target outcomes that we are wishing to purchase, and then we will ask the Social Investment Agency to go and identify those providers who they think are best placed to deliver those outcomes. The outcomes are no mystery. They're very clearly related to our public service targets, which involve reducing child and youth offending, reducing violent crime, fewer people on job seeker support benefits, increased student attendance, and more students achieving at expected curriculum levels, fewer people in emergency housing, as well as the objectives we have in our child and youth strategy and our family violence strategy. So a focus on the first 2,000 days, on child material hardship, and on preventing child harm.
Kia ora, I'm Jeanette from North Able. I've been with North Able in Whangarei and Northland Focus for the last 12 months. Prior to that, I was working in Western North Auckland and co-developed the Te Aka Manukau model, which helped young people get back into education, and in a context where there are other services to connect. So we had our social services, our health services and our education services working together, and that worked really well. Now I find myself in Whangarei and in Northland and in a disability sector where actually service poverty is a major issue, and the ability for social investment to work in a space where there is a lack of service, a lack of workforce capacity. So I'm interested in, one, I'm super excited about this initiative. I think it has real potential, particularly if it can work alongside a community to address that service poverty. Everything is interconnected, so at North Able with the FASD lens, we're really mindful of youth justice, engagement in education, mental health, all of those sorts of aspects, and working together. So I guess it's just what is the capacity to be able to work alongside communities with this fund, with this approach, where you won't see the outcomes initially because there aren't the services to be able to connect into, and whether there is a space, I guess, to be able to look at how you resource community more effectively, particularly in our rural street communities. Te Taitokoro, Tairāwhiti, those sorts of places, I know really struggle with that.
Yeah. Look, it's a really great question, because social investment is necessarily focusing on how can we do that integration of approaches we know have impact and work better with community providers to deliver that. But there's still an essential role for government agencies providing essential services, whether that is supports for people with disabilities, whether that is our social welfare system, whether that's schooling, whether that's health services. And so the way that I see social investment is that yes, it's the work we're doing in the agency and with the fund, but it is also as a government holding ourselves to account that across each of those areas, whether it's health, whether it's education, asking ourselves, are we investing our dollars in the best places for the most impact? And there are obvious thoughts that occur once you have that discipline, which is, I think we all know. We would like to see more investment in primary health care to prevent people ending up in hospitals and emergency rooms. And so we need to bring that focus to our work in health. And there are other areas like that. I'm up front, and I've been very upfront with New Zealanders. This is not a time in which we have magic money trees in the garden, unfortunately. If any of you find one, please let me know. It would make life a lot easier for all of us. But we are constrained in our resources. So now more than ever, government has, I think, a duty to say, are we driving maximum impact from every dollar? Are we investing in the right things? Are we investing well? Are we wasting money on making people respond to audits and bureaucratic requests when that money could be invested in our communities properly? And so that is the task that we have. And I want to acknowledge what you're saying, which is we actually do want to have integrated services within communities, and I fully acknowledge that that's the direction that social investment needs to go in over time.
Katie Bruce from Huria Community Aotearoa. Thank you for your acknowledgement of our sector as those who know Whānau best and who are best placed to be working alongside them. I'm really interested in, so this $190 million fund. It would be really great to get some assurance that that is new money.
It is new money. Every single dollar is a new dollar. It is additional. It is a separate initiative in the budget of new money for this fund.
Thank you. Is there anything else you can tell us about the priorities for the fund? Because providers are really going to want to know, well, okay, those are some really broad things you just said about kind of public service targets. Where do you see
There's a couple of things that are very important, as I detailed in my remarks. One is about willingness of providers to take on this approach, which is data and evidence informed. We do want providers who have demonstrated that they are able to use data and insights and evidence, that they have some success record and some proof of delivering outcomes. I know that Andy's biggest nightmare at the moment is worrying about how many people will come to the social investment door. And so the Social Investment Agency will be working to triage that. And as I say, our job now is to focus on those areas where we know there are gaps and where we know we can have success. Because if we prove this out, this fund will grow over time. So I ask you to join on this journey with me, knowing that not everyone will get an initiative through the fund immediately, but as we prove it out, that fund can grow. As I said, there's $7 billion at stake in terms of government contracts with social services providers, and I see no reason why we shouldn't aim over time to have much more of that funding integrated into this fund so that we can work with you better. Mm-hmm.
And then there's 20 million for the 2,000 days
Mm-hmm.
and 25 million for funding the
Mm.
So that's not even 235 million, so I wonder why it should be under 40.
Yeah. Yeah. Well, as I said, our goal here is much more ambitious than the 290. Much more ambitious than the 190. Our goal is to integrate more funding and service provision over time. So you can see that in this budget with child and youth strategy, where we're trying to do better interventions in the first 2,000 days. Instead of just commissioning $20 million worth of services over here, we're integrating that into the social investment approach. You can see that with the response for children who've been abused in state care. The response to that, instead of saying let's try a new thing, we're going to do it via the social investment fund. So the 40 million you refer to is so that we can actually build a data system and a way of working that is capable of operating at significant scale, so that we have the capability to take on a lot more funding, a lot more contracts, and the ability to genuinely integrate activity that is currently siloed across government agencies. That money speaks to our ambition, which is that this is the first 100, this is the first 275 million, but my ambition is a bit bigger than that.
Sure, my name's Shannon. I'm from grandparents raising grandchildren. A lot of these services rely on skilled staff. How is your government going to ensure that we can attract and retain those staff, specifically support workers, disability workers, social workers, especially when their pay equity claims are just being squashed a little bit?
Well, look, we still continue to have a pay equity regime in place, and I want to reassure you that we fully expect that there will be claims and that many of those claims will be successful. We have put aside funding in our budget to ensure that where claims are proven, that we are able to fund uplifts in pay for affected workforces. I want to reassure you of that because I'm not sure that everyone has heard that message, and it is the government's sincere commitment. But of course, as you well know, not every pay rise comes from a pay equity settlement. Pay rises also occur in negotiation between employees and employers. And the conditions in which pay rises faster are the conditions in which we have a growing economy. And the struggle that so many New Zealanders have had over these past few years is that even while their wages were growing, prices were rising faster than their wages. So their real income was being eroded as costs in their life went up significantly. So our commitment in terms of addressing that cost of living for workers across the economy is that we've got inflation back under control so those costs aren't rising as fast. And then we want to ensure we set the conditions for incomes to grow faster, which for us involves getting this economy back to growth, back to stability, and ensuring that we can all have more funding. The simple thing is this: if I want more money in the budget pot next year and the year after that, I need more tax revenue that will come from a growing economy, not from confiscating it from other people, but from growing the economy so that we have more choices and more opportunities.
Would there be a consideration of a co-design with your team? Because we're all different geographically.
I'm going to give this to you.
In terms of context, it's something I just wanted to ask about.
Yeah, well look, obviously the Social Investment Agency have been doing a lot of work on how these outcome contracts will be set up, so I'm actually going to throw to Andy to give you a bit more on that process.
We know that what we see at the moment is a huge amount of data being sought, which is often output oriented, so ticking some boxes. We know that a lot of that information is not used in the way that you would hope it would be, given the amount of work that goes into preparing it. So when we're taking an outcomes-based contract approach, what we're wanting to identify is the few things that if we measured them would give us a real sense that the service is making the difference we hope it would make. And that should be a reduction. We also know, and the Social Investment Agency has a role in setting standards across the system. And one of the areas that we're particularly thoughtful about is how we can ease the burden of reporting that exists across a lot of social contracting. So it's very much in our frame. There's, as you'd appreciate, quite a lot to unpick there, but we intend to start leading by example through the Social Investment Fund in terms of what efficient and effective contracting looks like.
And we know that if we sit at the table together at the beginning and agree what would success look like, how will we measure it, what are the indicators, and we have that agreement together, it allows for much more successful collaboration through the contract. So much better than what is often the status quo, where you're told these are the outputs you need to deliver, even though you may know they are disconnected from what would have the biggest impact for the people you serve. And so we want to have those conversations up front and be clear about what we're all at the table for.
There's one over here, Minister.
Yes.
Hello, Minister. Thank you very much for your presentation this morning. I'm Carly Kennedy from Ngāti Whakaoro. I've got two partai for you. So the examples that you've given this morning are regional organisations. So I just really wanted to check in and see what was the agency's view on more localised approaches to social investment, specifically from a iwi Māori perspective. That's my first question. My second is on data. So we talk about assessment of, a program, outcomes, those sorts of things. We're talking about qualitative or quantitative data. What is the view on measuring well-being from a qualitative perspective, taking into account Te Ao Māori concepts?
Well, I'll take the last question first. So going back to what I said earlier, which is let's agree at the beginning about what it is that we are wanting to achieve. So often the government will be clear that what it wants to see, for example, is children getting better access to immunisation and health services in the first 2,000 days, to see less family violence in the home, to see children more likely to be engaged with education. It can set quite clear outcomes for what we want to see. But then what we need to work with you on, using whichever kaupapa it is that your community and your organisation has had success with, is to say, what do you think will be the success indicators of this, and how will that show up in the data? And so those do need to be conversations that we have together and agree, and they will vary depending on the work that is being done. And of course in New Zealand we are very fortunate. We have this extraordinary sophisticated tool called the Integrated Data Infrastructure, which allows us to completely anonymously see what impact we are having. And so we believe that that will be really helpful in ensuring that we can all be on the same page about what's happening for the people that we're serving. Then there was the first question, and I can't remember it. So Andy's going to do it.
So what we've seen is across the Motu there are many different approaches working in different places, and it's not one size fits all. And so part of what we will seek to understand when we're engaging in an area is who is best placed to work with those in that community. And so that doesn't mean it's regional or very local. It could very easily be a mix of those things. The other piece is recognising that there's often alignment between what families aspire to, what their local communities aspire to, and then the things that government would want to achieve, but we express them differently. And so when we're engaging in a conversation about a contract, government will have some things that it is looking to achieve in terms of outcomes, but very often the way those outcomes are delivered will be through local approaches that work for the community that is being helped. So there's space to accommodate a range of outcomes, if that makes sense. Maybe just last one, and then we will.
So we represent 250 community-based organisations that sit across 17 funding agencies.
Yeah.
So a lot of the issues that we're looking to resolve are really welcomed, and we really look forward to solutions and working together. The long-term solutions, the less administrative burden, these are things that our members really suffer through on a daily basis. A couple of observations.
conversation about what we provide, but often providers do great jobs of tracking their own interventions, but then can't see where they touch other parts of the government system, particularly doing social injustice in education and health. So it'd be great to know what kind of working is going on there. It would also be great to know when we can get involved. I know my phone will also be going hot on people being excited about the funding, how they access it, and it's great to see the three initiatives, including some of our members and part of that first group. But it'd be great to know how we work together and partner to solve these really hot, complex issues. We really love fair funding, so some of this is given to the community sector and get it cheaper, whereas these are really complex and hard issues that need long-term solutions and adequate levels of funding to actually resolve these matters.
Yeah, kia ora. And thank you for the work you and your organisation do. In terms of the data, you're really preaching to the choir with me, because my view is government spends a lot of resources on your behalf and a lot of effort collecting a lot of information. And in a democracy, wherever we can, we should be sharing that so that people can make good use of it and create impact with it. So the Social Investment Agency, I think, have done some really good work. I'll let Andy talk about it, to just make some of the data that we already have more accessible, so that on a community by community basis you can look at it and understand what's happening with the key education indicators, what's happening with the key health indicators, integrating that in a way that's visual and effective. But I'll just let you say a little bit more about that.
Thanks, Minister. So the recently released tool late last year that the SIA has got up on its website was a Regional Data Explorer. Brings together about 70 data sets primarily from the IDI. You're able to cut that data in different ways to understand for a location, and then from different sort of focus areas what the dynamics are in a particular community. And that tool is a great starting point for organisations who want to think about, you know, if we're going to apply to the fund, what are the outcomes that we think we deliver? Who do we think we deliver them for? How does that relate to the actual need in the community in which we're operating? Because that's a great starting point for conversation. We recognise that there's quite a rich lot of data that government has, and we want to continue a dialogue really about how we make that available, recognising we need to balance really carefully the privacy considerations and other interests that exist in data really respectfully. But that data tool is fully anonymised. It's not going to allow you to identify people, but it does get you to a really interesting view of communities and the people within them.
And we recognise too that sometimes you have more granular data than we do, because on a community by community basis, sometimes those providers working closest with families know what's really going on, and our data isn't always as up to date. So I think it does need to be a two-way exchange.
Thank you. I'm sure there'll be a lot of other questions in the room, and just really want to acknowledge our Minister for her work here today before I carry on. Thank you.
Thank you.